Chapter 7 continued. We will continue with the physical effects of alcohol. So, short-term effects from low to moderate. Low to moderate doses will cause disinhibition, which is a loss of conditioned reflexes. One person can become euphoric, friendly, talkative, that's your happy drinker, where another person can become aggressive and hostile, that's your mean drinker. It interferes with motor activity, reflexes, and coordination. Usually this is not apparent to the drinker, so they don't really realize that they're stumbling along. Behavioral effects are variable and a bit unpredictable. The social setting and mental state has a large influence on the effects of alcohol. With moderate doses, you have slight increase of heart rate, it dilates blood vessels, and moderately lowers blood pressure. It stimulates appetite and urine output. You know when you break that seal? In high doses, the setting has little influence on the expression of effects. So you have it incapacitates, so an individual may have difficulty walking, talking, or thinking. That's your falling down drunk. It will induce drowsiness and cause sleep. Highest doses produce incoordination, confusion, disorientation, stupor, anesthesia. It can even cause coma and death. The lethal level of alcohol is 0.4 to 0.6%. And what happens is a person dies because of the severe depression of their respiration center. Typically, a person will usually pass out before they can ingest that much alcohol. The general rule is take as many hours as drinks to sober up completely. Coffee, cold shower, and oxygen will not speed up this process. You'll just have a drunk who is awake. But it's not going to help judgment or their reflexes. Those things will not be improved by coffee or a cold shower. The hangover. The hangover is characterized by fatigue, nausea, upset stomach, headache, sensitivity to sound, or ill temper. Symptoms usually are most severe many hours after drinking, when no more alcohol remains in the body. There's really no simple explanation for the hangover, but theories include an accumulation of acetaldehyde, so that's a metabolite in your blood that causes vomiting. Dehydration of tissues, so your meninges become dehydrated and that's what causes that headache feeling. Poisoning due to tissue deterioration. Depletion of important enzyme systems which you need to maintain your routine functioning. Acute withdrawal or rebound response. And the metabolism of impurities. The type of beverage may influence your hangover. So, for example, if you are sensitive to impurities, then maybe vodka or gin would be a better choice for you because they have fewer impurities than whiskey, scotch, or rum. There really is little evidence that mixing liquors is a cause for having a severe hangover. Typically, it's because you just consume too much, and that's why you have a hangover. Dependence. So, sometimes when someone becomes dependent, they're dependent on the psychological effects. So, they become compulsive, and so they want to continually consume. They become unable to function normally without it. Physical dependence also results, which becomes apparent when withdrawals result from abstinence. Severity of withdrawals depend on the length and intensity of the habit. So prototypic withdrawal patterns include stage 1, which is minor, restlessness, anxiousness, sleeping problems, agitation, tremors, and a rapid heartbeat. Stage 2, which are major, include minor symptoms, such as hallucinations, whole body tremors, an increase in blood pressure, and possibly vomiting. Stage 3 includes delirium and can include symptoms such as fever, disorientation, confusion, seizures, and fatality in 3 to 5% of the cases. Recovery is long-term, and many relapses due to severe withdrawal and the need for behavioral adjustments do occur. It's still easy to relapse after years with enough stress to cause a person to relapse back into using alcohol. Medications for dependence. Only 10 to 15% receive appropriate treatment, and this is partially because people believe it's willpower and medicine cannot help. The FDA has approved 3 different types of medicine for adjunctive treatment, and this includes antabuse, naltrexone, and Camprol. All 3 will either help to the first one, antabuse, will make users very sick and nauseous when they drink, and so it helps to motivate them not to drink. Naltrexone relieves cravings and reduces the relapse rate. Then there's also the Camprol, which will help to reduce withdrawals. These are not universally effective. A person must be subtyped. For example, you need to look at age, gender, duration of dependence, their mental status, and appropriately match the prescription. And it also should include behavioral therapy as well. These medications aren't enough. Alcohol and genetics. Addiction or alcoholism is among the most inherited type of mental illness. Contributing genes will influence excessive consumption, dampen the signals that I drank too much, or enhance the pleasure from alcohol. Intensity of the hangover or other negative effects may also be influenced by genes. The environment is equally important. If you have a supportive and healthy environment, it can decrease that genetic influence. Effects of alcohol on organ systems and bodily functions. So as you can see, alcohol will affect your personality, skin, lungs, liver, and kidneys, as well as nutrition, and will affect your central nervous system, sleep, heart, blood, and immune system, bones and joints, digestive system, and sexual functioning. The brain and nervous system. Every part of the brain and nervous system is affected and can be damaged. Even moderate intake can cause brain shrinkage, so 14 drinks per week can lead to a 1.6% loss. Low to moderate doses suppress the subcortical inhibitions and increase your endorphin release. Higher doses cause slurred speech and staggering, impaired vigilance and decision-making. Very high doses depress the respiratory systems and again can lead to death. Heavy drinking over many years may result in mental disorders and irreversible damage. Permanently compromise mental functioning and memory. The liver. Liver disorders are responsible for about 10 to 15% of deaths among alcoholics. There are 3 stages of alcohol-induced liver disease. The first is alcoholic fatty liver, or hepatotoxic effect. This is an enlarged liver due to increased fat production. It is reversible and can disappear if drinking stops. Then there's alcoholic hepatitis. This is where fat cells continue to multiply. Chronic inflammation can be fatal, but again, it is reversible if you stop drinking. When you have cirrhosis of the liver, that's where you have scar tissue that forms, and it causes hardening as functional tissue shrinks and deteriorates. It often can be fatal, but again, not reversible. Liver damage can cause problems for taking drugs that affect liver function, for example, Tylenol. In the diagram, we have an example of a healthy liver and a liver that is affected by cirrhosis. Digestive system. Alcohol irritates and can damage tissue. And this is because it causes a chronic acid imbalance. inflammation, and acute gastric distress. 1 in 3 heavy drinkers have chronic gastritis. Heavy drinkers have a 2 times probability of developing cancer of the mouth and esophagus. Prolonged heavy use can cause ulcers, hiatal hernias, and cancers of the digestive tract. The pancreas is also affected. You can develop things such as pancreatitis, pancreatic cirrhosis, and alcoholic diabetes. Your blood. High concentrations diminish the body's ability to make blood cells and decrease production of red blood cells, which can lead to anemia. White blood cells, which affect your immune function. Platelets, which will help with clotting. And if you have issues with this, it can lead to something called alcoholic bleeding. It increases your chance of developing an infection. And heavy drinking appears to affect bone marrow, where blood cells are formed. Your cardiovascular system. You have dilation of blood vessels, especially in your skin, accounting for flushing and warm sensation. Have you ever seen an alcoholic where sometimes they have like broken blood vessels on their nose? Long-term effects are dose-dependent, and it's suggested that low doses have health-promoting properties, but some suggest that really this is about lifestyle. If somebody drinks a glass of wine a night for health benefits, typically this individual is doing other things that are healthy in their life, like exercising and eating well. Some people do drink for stress relief, but it will increase your HDLs and lower your blood clots in your arteries. It replaces heart muscle tissue with fat and fiber, so your heart can become enlarged and flabby. And abuse can lead to irregular heartbeats and high blood pressure or even stroke. Oops. Other affected organs. Your sexual organs. Continued use can cause prostatitis, which interferes with the maintenance of an erection. So you've heard of whiskey. Atrophy of testicles results in lowered sperm count and diminished hormones. And your endocrine system, your hormone messengers. It influences production and release of hormones. So testosterone levels can decline, which can lead to impotence, breast enlargement, which is not good in a male, and loss of body hair. You have menstrual delays. Your ovarian abnormalities and infertility can also occur. Your kidneys. Damage reduces ability to process blood and form urine, which can lead to metabolic problems. And many individuals who drink too much alcohol experience more urinary tract infections. Mental disorders and brain damage. Persons with mental disorders are significantly more likely to have an alcohol problem. Perhaps this is because heavy alcohol use compromises those parts of the brain that control emotion and social behavior. The Wernicke-Korsakoff syndrome is a psychotic condition caused by alcohol use, and it's related to nutritional and vitamin deficiencies. Loss of memory causes people to make up fictitious events that the person actually believes are facts. This is a cute little video on beer goggles, and you will find this under films. The fetus. Alcohol easily crosses the placenta. It damages the fetus with moderate to excessive drinking and can cause spontaneous abortion because of the toxicity. Fetal alcohol syndrome is characterized by facial deformities, growth deficiency, and mental retardation, as well as joint and limb abnormalities. The severity of fetal alcohol syndrome is dose-dependent. A safer lower level of alcohol consumption has not been established for pregnant women, so you really should not drink during pregnancy at all because a safe level is not known. Individuals who drink during pregnancy will have babies that are born at a lower birth weight. And this is due to the alcohol itself, not because they smoked or the age of the individual or how many babies they've had in the past. Just a few episodes of heavy drinking during pregnancy increases the risk of offspring to abuse alcohol. Here is an example of a child born with fetal alcohol syndrome. So you see they have small eye openings, a short nose, a flat midface, thin upper lip, underdeveloped jaw, and small head. Gender differences. Pharmacological differences in how males and females respond to alcohol. Heavy alcohol use among females causes accelerated damage to the brain, liver, heart, and muscles. It may be because it's metabolized slower due to the higher fat content in females. Problems may also be expressed differently. Females express depression, while men binge drink and fight. Different responses to treatment. Women tend to have later onset of alcohol use, a positive family history, and more marital disruption, and it's associated with psychiatric disorders. Malnutrition. Frequent and extreme serious consequence of severe alcoholism occurs most often in the less affluent. Alcohol beverages contain almost no nutritional value, just large amounts of carbohydrates. Because it has a high calorie content, drinkers don't get hungry, but they don't receive any nutrition. So, great taste, less filling. Malnutrition may exaggerate the damage that alcohol causes to organs, especially the liver. Heavy alcohol consumption is associated with low fruits and vegetables and high added sugars and unhealthy fats, about 3 to 1,000 calories per day, approximately 50% of which is alcoholic beverages. Malnutrition problems may be further aggravated by the damage done to the GI tract. Damage to the lining of the stomach and intestines affects proper absorption of nutrients from food. And that is the end of chapter 7.